Hi, class. Today we're going to talk about chapter 24, which is radiology. Again, this is in your mod that we're discussing right now. And so, with radiology, it's the branch of medicine that uses radiant energy to diagnose and treat patients. Specialists in radiology are called radiologists. Okay. Now, you do have a higher form of a radiologist. Those are called intervention radiologists, and we'll talk about that in a little bit. Okay. Okay. So you have some subsections of radiology. You have the diagnostic ultrasound, the radiologic guidance, the breast mammography, bone and joint studies, radiology, oncology, nuclear medicine. You have fluoroscopic views, the inside of the body, which projects onto a television screen. You have live images by which physicians can view function and structure of an organ. Then you have magnetic resonance imaging, and this is to help view soft tissues such as the lumbar or maybe somewhere in the hip area. I've had an MRI done of my lower extremities. I think it was waist down. And so just to see how things are going with me. Now, with this, you have on slide number 6 on your lecture slides, where it's doing a visualization, the MRI, of blood flow as well as images of normal and diseased blood vessels inside the brain. You have tomography, which is used for a single plane of the body. You have a CT scan, which is looking up lung cancer. So you have different reasons for different things dealing with the radiology of the body. Okay, the biometry, the application of statistical methods of biological facts, ultrasound diagnostic in non-invasive procedures are performed to determine composition and contours of an ocular or orbital structures. And again, this chapter 24 in your step-by-step book talks about the planes of the body, just the way we did in the anatomy physiology book when it talked about body structures and different parts of the body. So all things work together for the good. Okay. Oh, I got something in my eye. That's not good. Hold on. Okay. All right. So moving on to the next slide, position and projection terminology. Radiology uses a wide variety of terms and abbreviations specific to planes, positions, and projections. It's real important that they use that simply because they have to tell what side that they take this picture on. You know, what view was it? You know, so it's real important that they do that. Oh, wow, this has 66 slides. We talked about modifier 26 whenever you're using modifier 26 and you're doing procedure coding. You use that for a professional component. That professional component is the supervision of the technician, the interpretation of results from the radiology doctor, and use TC. It used to be a long time ago. We used to use modifier 27, but now it's TC, which charge for the services for the equipment, the film, and the supplies. Some things are done globally. When it's done globally, that means it's all comprised in one price. So let's suppose if your procedure code for radiology is normally in the 70,000 range, okay, and use 70,000 with modifier 26 for interpretation, and use 70,000 with the modifier TC for a technical component for use of that machine. Now, instead of charging separately, sometimes they can charge globally under one price, which may be that first line of a code. And we'll talk about that more later when we get into coding. And so I'm going to have another lecture series about that and how it appears on your HIPAA form, okay? Okay, fantastic. Okay, so let's see, global procedure, x-rays, third-party payers. Okay, so you have third-party payers. Usually reimburse 40% for professional, 60% for technical, 100% for global, okay? And we'll go more into that later. Now, overview of radiological subsections. You have diagnostic radiology, diagnostic ultrasound, radiologic guidance, breast mammography, bone and joint studies, radiation oncology, nuclear medicine. You have diagnostic radiology such as complete. You also it's a whole plethora of things which you can do with this. I'm going to let these slides explain it for themselves to you because it's pretty much self-explanatory. It's not really a whole lot to do a lecture series on here. But I will say this. You have nuclear medicine type people that deal with you doing an echocardiogram or different things that help speeds up your heart to understand the strength of your heart. You have an intervention radiologist who could probably do some things like a regular surgeon, but they're using the X radiation to help perform a certain surgery procedure, which is pretty interesting. And so that's it for that. That's kind of short there. What I would like to do is create another video on the coding guidelines, be it procedure code, be it diagnosis code, on how to code these things and how to use that. So yeah, I think that's it for right now that I'm going to do. I found this quite interesting. So we'll pick this up a little later. I have a lot more I want to say, but that was not enough for what I want to use. So anyway, that's it. If you have any other questions for me, and I'll probably retouch this video again a little later once I look at it. And come back on video to chat about it. Okay, all right. Well, this is Mrs. Harper signing out, and I hope you people have a lovely and wonderful day. And again, pay attention to these videos because I do give quizzes according to the video, and I do give quizzes according to the lecture notes that's on the online subject that you all use and do your homework from at home online. All right, have a wonderful day, and we will chat later. Bye-bye.